Good afternoon, everybody, and welcome to this week's Power Hour. We are very grateful that you can join us today for this very special session. Today we will talk with three colleagues of yours from across the sea. We have three Italian doctors that we're going to talk to you about COVID and how it's been for them in Italy. As you know, the Power Hour comes to you every week. We have a different range of topics, and the whole initiative was born out of the need to focus more on conversation, collaboration, and community. For this session, we will ask you to keep yourself on mute unless you're speaking, but we do invite you to engage with the speakers, the guests, and ask questions, and just unmute yourselves and ask questions. You can also put the question in the chat box, and we will, as the flow of the conversation permits, go get to that. And you will find a recording of the session by midweek next week up on our landing page of the North Carolina Medical Society Foundation, and more specifically, the Keenup Institute for Physician Leadership. My name is Christina Nattherdog. I'm here with my colleagues Aubrey Cuthbertson and Franklin Walker, and I'm going to hand it over to Franklin Walker, who is the moderator of the session. Franklin?
Thanks, Tina. Welcome everybody to week 12 of Power Hour. We're excited to go across the pond today and speak with some of our colleagues, as Tina said, from Italy. And I think what might be useful is for us to go around and let the physicians tell us a bit about their specialty and where they're actually located in Italy for those of us who are not very familiar with Italian geography. So is Dr. Villari, will you start please, sir?
So hello everybody, thank you for the invitation, and let me say hello to my sister. And I live in northwest of Italy, in Torino. It's quite a big, 900,000 people city, and I work in a big hospital, and I am psychiatrist, but I'm also the head of the department of neuroscience. So I have the responsibility of neurology, neurosurgery, psychiatry, with emergency ward, and of course ambulatory and ward. So very complex system, and we had to face this new situation. At the beginning we were quite, we didn't know really what was happening, and we didn't know what to do. But soon we realized that the main problem was to keep the patients separate and try to understand as soon as possible the one who were infected and the one who were free, COVID-free. It really has not been easy because we didn't have the laboratory at what we need to do everything very quick. At the beginning, we had to wait more than 12 hours in the emergency room to know if a person was positive or negative. Now, a couple of hours is enough. And the second thing was just to protect our colleagues and nurses. At the beginning, we had problems because we hadn't enough staff and device to protect people, and it was really quite shocking. But at the end, in a couple of weeks maybe, everything arrived, and now, of course, we have to face a totally different situation. That is how get off of this emergency situation and come back to normal routine, because in these 3 months, almost 3 months, we stopped all the routine activities. So we have now hundreds of people that normally had to be visited or had to be recovered in the hospital, that remained at home. And so we have a very big queue, very big problem to have thousands of new visits without room enough to do it. So at the moment we have this problem.
Thank you. Dr. Vignati, can you give us some background on yourself, please?
Yes. As I told you, I'm a psychiatrist, and I work in a in a big hospital of a city, 900,000 people city. And I started working as psychiatrist, but since 6 years now, I am the head of department, so I have to take care of the whole system. We are almost 500 people that work in my department with almost 100 of beds, and I have to run the system. It is not so easy. I've read an interview to one physician in States. Somebody asked him, why you don't want to be a head of department? And he said, because I don't want to take care of pencil sharpener of my colleagues, and I really now know what he meant.
Gotcha. Thank you. I don't know. I'm going to try this again. Maybe I'm Vincenzo. Can you give us your background, please?
I think
I
you,
don't
think
are you trying to go to Giacomo, Dr. Battagnani?
Yes.
It's Giacomo. Okay.
Yeah. First of all, I present myself. I'm professor of surgery here in Florence, in Tuscany, which is south from Turin, where the other colleagues is from. And my work is mainly general surgery with special references to hepatobiliary and pancreatic surgery mainly, but other general surgery we did usually at our place. So the situation now is much better, even though there was not so bad at all here in Italy, which much worse was much worse in the northern Italy, as you know, probably know, in Lombardy, mainly Milan, Brescia, and Bergamo as well, and Turin, where the other colleague spoke from. Which is the other topics? Sorry.
Oh, that's fine. That's great background. Thank you, sir, for getting us there. We know that in the U.S. we had a very disjointed, and we still do, plan for dealing with COVID. The federal government has not really stepped in and presented a nationalized unified front, and it's been left to the states individually to come up with a testing protocol. And it has just been very interesting, to say the least. I'm wondering about Italy's response. How was your federal government's response in comparison to the United States? Was it a unified national plan, or was it broken up by region? And Dr. Villari, can you answer that, please?
First of all, I want to tell you that we had different waves. We had the first wave, that is a wave of infection, the illness. The second wave has been the emotional impact of infection. The third wave is economical consequences, and the fourth wave is just coming, is the legal consequences. So we had really different approach to all these. What has been very important to me is in Italy, maybe it's quite characteristic of our state, we have been really a big fragmentation. We had dozens or maybe hundreds of different agencies that wrote different rules, and they are all very, very difficult to keep in mind all together and try to have a unique direction. So we have government, different ministry, and the local regions and the local cities and in hospitals. It really, in my opinion, this is at the moment very difficult to keep a unique approach. This. And now I think that the infective part is almost getting better. We're not out, but we're trying to face it. But we have the main problem is the economical one. We have a very deep depression. A lot of people remain without work. And what is very strange is that we had that almost split effect, because almost half, maybe a little less than half population, 40%, had big economical problems, but other had more income, because some business went really well, for example, food, delivery, and normal people, the one that have a salary, they in 3 months really spend not so much, because we hadn't how to spend money. So we have these two group of population, but a lot are really in a miserable situation without money, and the government is trying to help this, and also Europe is trying to help this.
Okay. Dr. Begnati, tell me about your thoughts on that question. Are there any other things that you'd like to add?
I was telling that we have this problem which seems to be like yours in the States because of the fragmentation in the health system. Is not the same in Italy. We have different, and now we have politicians that are fighting to each other. Seems to get this situation between, for example, Lombardy and the central state. So we had quite different systems that reflect mainly on the general medicine doctors, which were probably most affected from the infection, and they have to fight and to treat this infection without protection in some cases, and they ended with a lot of infection among them and among health workers as well, nurses and others, because of the lack of the mask and gowns and gloves they had, and probably because we know little about the virus and his contagious the outbreak, I mean. So this is probably was one of the main problem we had, along with division in our regional health system, which is not the same in all the region in Italy, and it's quite different between the north and south, as you probably know.
Right. I want to come back and talk to Roberta Pascoletti. Dr. Pascoletti, I'm sorry we missed you on the first go-round, but would you please give us a little background on your specialty, your practice, where you're located in Italy, please?
So I live and work in Florence, Italy, same city of Dr. Battignani. and I am a pediatric ophthalmologist. I doctor for children, and I work in one of the major pediatric hospitals based in Italy. And my job is mainly, it's even medical and either medical and surgical. So basically, I work with children. And of course, we are not being a COVID hospital, even if we have had some cases, because, as you know, even children can have COVID disease. And but as ophthalmologist, I'm not involved in a first line with the COVID treatment. But I experienced, of course, all the problems that other colleagues have said till now, like in the beginning, the shortage of PPE, and for ophthalmologists, this is a big problem, because, as you know, when we see patients, we have a short distance for our visits. So we should have every time a PPE, and sometimes the patient doesn't have, only because they are children and they don't want to wear masks or other procedures. So sometimes it was very difficult at the beginning, even because we didn't know enough about the virus spread, and so we have to be very careful about that.
Thank you. And I'm sorry we missed you on the first go-round. Italy, I think, has a population of about 61 million. And I checked the numbers yesterday. Your current fatality rate from COVID is about 14.5%. And the U.S., by comparison, is about 4.7%. And I think we've established that there was a disjointed response from the governments in both nations. And I'd like to get your views on why Italy's fatality rate is so much higher, almost 3 times as high as the United States. Maybe there's some contributing factors that you all could attribute this to. Roberta, would you like to take a first whack at that?
Yes, of course, I cannot have the right answer, unfortunately, but, you know, there are a lot of hypotheses about that. I guess that the main problem at the beginning was because we didn't know enough about this virus. This is something new, something that you can try to do what you think is correct, but doesn't mean it is in the most of the cases. And the real problem, I guess, was the doctors that first had to care patients with COVID. They didn't recognize the virus, and it could have been the reason for such a large spread. And because it's high contagious, this virus is highly contagious, possibly a big number of population has been contagious, because some, we cannot exclude that some environmental factors could contribute to the spread of the virus. And after that, all the medical doctors that cared about the patient admitted to the hospital, in the most of the cases, were without PPE. And if you have a patient with COVID, you can almost be sure that you can infect by the patient if you don't have any PPE.
Okay. Yeah, thank you. Dr. Begnotti, can you help with that question as well, please, sir?
Yes, but we had a lot of numbers, and at the beginning, I think that we had a lot of numbers that were quite meaningless, because we really don't know what happened, and we didn't know how to relate this number with the system. We didn't know how many people was affected and how many people in the general population has been in contact with the virus, and among those, how many got really sick, and among those, how many got serious sick that were close to die. So it's very difficult, I think, till now, to make confrontation in worldwide populations. So in Italy, we had for sure a different situation in the north, in Lombardia, but also in Piemonte and in Veneto. That's the first impact. And I think that it happens because these areas are the most active by the industrial point of view, and they had contact with China, and the virus arrived here. And in the south, they're still protected because they stopped the connection in between our country and also between different countries. So I think that at the moment it's still very difficult to understand the entity of the problem.
Thank you.
I don't know
Dr.
if
Batting,
I don't know if in
sorry.
the States you have clear ideas about that. The epidemiology, is it clear?
Oh, I don't think it's clear at all, but I'm not a clinician. I think there's been a lot of deniability at the top of our government. We, I think, arguably wasted 2 months of time knowing that the virus was out there, which leads me kind of to my next question. When we did have our federal government kind of not doing a whole lot for 2 months, were your politicians in action early on, or were they kind of in deniability, or in a way denying this was coming? Dr. Battagnani?
First of all, I would like to intervene with the previous questions, because most of the infections, it depends on how many tests you make. So that's probably is one of the major issue in the epidemiology of this, because if you like in the Veneto, they perform a lot of swab, nasal and throat swabs, and they found a lot of infections, and so this is certainly a cause of a reason of the high incidence in that place. So if you do more tests, you will have certainly a more infected patients. So having said that, and coming to the other question, which is that reported in the chat, what changes do you think should be made in light of what happened initially and subsequently? Is this the question? Sorry.
Yes, please.
Yeah, certainly. A big issue is still the test. Made or not to made the test. This is a two different way to see at the problems. So you can also choose to don't make the test and see what's happened, because it's an infection and probably is a highly lethal infection, but it is still is a flu-like infection. So what we need is somewhat immunization as well, either naturally or with vaccine that we all still hope. Having said that, what can I think that we did all we did at that moment, because of we know little about this virus. We now know something more. We know that cortisone is effective, heparin is effective. So probably these two drugs are those who probably should have used more earlier. And now we have to use those drugs. But the most problematic issues is ICU beds and the availability of those beds. So now we are back in a state where we have a lot of beds available. So we probably can manage better, absolutely, the eventual rebound or some infections that may arise from small area, which in other words can be also be better controlled and blocked if necessary. That's my thoughts.
Thank you. I want a follow-up question with you, please, sir. We in the United States are experiencing another, run-up in cases, maybe a second peak. Where are you in Italy now? Are you declining on the curve? Are you about the same? Or are you going up?
Yeah, the curve is declined at all. With the R ratio is below the 1. That means that we have very low infections, and so we are happy with this. But we still face some infections in the small places, and this from yesterday early that a place near Naples have became infected from with 40 patients, and it is already isolated and controlled. As another place in the north, we had a courier that had a spread in the plant. And it has been is isolated and watched very carefully. But this is not a rebound that we have to face probably with the autumn and with next winter. Probably.
Okay, so you're expecting another surge this fall or this winter?
We hope no, but it is reasonable, like Hispanic flu did a century ago.
Right. I want to switch gears for just a second and go back to Dr. Vallare. You had mentioned there were several stages of damage to, the Italian country based on the clinical and the economic damage. Yeah. I know in the United States, the federal government has offered some assistance to healthcare providers and other small business people. Has the Italian government begun to put in place some economic recovery programs?
Yes, sure. And we also have been, at the moment, we are waiting, still waiting, but I think that we are quite sure that we will have a big aid from Europe, a lot of money. But I want, coming back to something that we were talking about a few minutes before, I want to tell that the problem is not just the virus. We had the virus, we had to face the virus at the beginning. Now we have many consequences. And in my opinion, we have at least three main consequences that are, first of all, economical, second, emotional. We have a lot of people with psychological or also psychiatric problem that goes from the sadness because they are poor to PTSD. Or don't forget that we had hundreds of people, they didn't see their family. They just they just saw them through window, and they didn't have anything. They didn't have the grief. They didn't can say hello to their family, and it is very heavy by a psychological point of view. And the third problem is to try to come back to assist the one who didn't come to the hospital during the outbreak. So we had half, for at least 4 weeks, we had half of admission for heart attack or even for stroke. So this is a big question. Why did it happen? And so we have to recover, and we have to take care of these people that during maybe 100 days, so 3 months, they didn't have the right care for their condition. So a very complex problem, and we have to spread. We don't have just to focalize on the first impact of the spike of virus. Almost is gone, and I hope that we don't have another one in the fall, but if it happens, okay, we will face it. But now we have many waves, different waves, and it's very, very heavy and difficult to face.
As a psychiatrist, are you also trying to help some of your colleagues in the hospital that might have suffered loss in their families, or just have emotional distress as they're treating this disease on the front lines?
A lot, really. We had different problems. We had general population with anxiety and a lot of phobic symptoms. We have people who had serious form of illness, and they remained shocked. I also, several colleagues, the ones who had weeks in which they fight with death, they are not fully recovered. There's something that seems post-traumatic stress disorder, or also a cognitive problem, because don't forget that this virus has also a neutrophilia. So maybe we have an emotional problem and a neurological problem. And third, we have workers. They've been really shocked. They're tired. They're still full of fear. So we have very complex problem, very heavy to face.
Thank you. Dr. Pascoletti, as you may know, in the United States, over the last couple of weeks, we've had a huge surge of cases, and what we've come to find out is a lot of those are adolescents or teens and young kids. So they're not adhering to, social distancing. They're not wearing their masks. I'm wondering if you're seeing some of that same behavior patterns out of the folks that you're treating in the pediatric community in Italy, and what your response or what the Italian response has been to that.
Children are less affected from COVID but it doesn't mean they are not. So there are a lot of reports, international reports, that shows that COVID is a different disease in children, and because that in the most of the cases they don't have they are asymptomatic. So we should be very more aware about staying with children. And I think that the lockdown of the school, it has been a good procedure just to contain the spread of the virus, because unfortunately children cannot stay apart each other, and of course they need to socialize, they need to stay together and close together, and this is a method of spreading the virus. So just to spread the virus to the family, parents, and all the other components of the family. And because that we adopted some system even in the hospital just to reduce the access of the patient. And as a child has to be accompanied by a parent, we limited this access to only to one parent, because usually they come with the two parents or brothers or other relatives. So this is something that we try to reduce as in terms of access to the hospital. And they don't want to wear masks, but I think that if we try to learn, to teach the children that they have to wear masks, I think that at the end they will learn. And there is a suggestion from the OMS that ask not to wear children to wear masks in children under 2 years of age, and this is because sometimes breathing through the mask could not be easy for little children, and if they have any problems, they are not enough able to say that there is something is not going good, and that's the reason, because they shouldn't wear masks. But for all the other children, they should wear masks, even if it's very, very difficult to transmit this kind of thought to the socially speaking.
Thank you. Elaine, do you have a question? I mean, excuse me, Tina. So yes, I was looking at Elaine, that's all. Yep.
So she's like, no. So it's interesting when we talk about the masks, right? And we talk about children wearing masks and they don't want to wear masks. We are dealing with an issue in the United States that adults don't want to wear a mask. So I was curious to hear what is currently going on in Italy in terms of the restrictions now. Are people required to wear a mask in the public space, and are they adhering to that? Or are we seeing the same phenomenon there as we see here? Oh, there we go. Dr. Villari is already prepared. He's got his mask. So I'm curious to hear, what's going on with that. I don't know, Dr. Pasqualetti, if you want to start off on that one, since you were just talking about the masks in children.
Okay, if the mask is not obligatory, but we should wear masks. It's obligatory when you are in a closed space, You can not wear mask when you are in an open space, but you have to maintain distance from people. This is what our government says to us. If you are in a hospital or in another closed indoor space, you have to wear mask and maintain the distance as well. For the doctors working in the hospital, masks is mandatory. And we generally, if we are not working with the patient, we wear a surgical mask. But if we are seeing patients and we are, in my job especially, I cannot maintain the right distance, so I have to wear constantly the N95 because it's much more protective. And in some cases, of course, I have to wear goggles, even if I wear glasses or the shields or gloves or everything we can we think is necessary in that particular circumstance. But usually, people are have to wear mask when they go outside home or yes.
And Dr. Villari, I know that it's, as we talked about before, the differences between the North and the South, and the North having been harder hit than the South. How are people in Torino doing? Are they wearing the mask? I saw you before with your mask, so you were obviously also in the hospital, but what do you see in Torino?
They should wear the mask, how the colleagues said, when they are in the closed places and when they cannot keep the distance. But not always they're doing that. There is a sort of switch between day and night. During the day, they're quite correct, but during the night, the young people in last weeks are doing something that is not so prudent. It means that virus is becoming very wise in thinking that he has to save us because we alone are not able to do it. So otherwise, we should have in a short time a very big rebound, but at the moment of luckily we didn't have it. So we are just trying to put our best way to face this tail, this last part of the tail.
I also want to point to, there's another question going on in the chat box, and I don't know if you all can see it, but there's a question about the, and I think, Dr. Vidal, you were referring to that before, the mental health issues in Italy, and that you see, we also see mental health issues in the US, obviously a huge increase, and there's an increase in domestic violence. Is that a consequence that you have seen in Italy as well? And I think the question is for Dr. Villari, actually.
Yes, definitely. We had a lot of domestic violence, but we had almost half of social violence because people remained locked in. So we didn't have violence in the street, but a lot of domestic violence, yes. Something that has been denounced, also that remained underground. It's very common. It's a tragedy, but it happened, yes.
And Dr. Pasqualetti, Dr. Battignani, how about Florence? Is the same? Do you have any idea about that in your area?
Yes, it's something that we knew. It's like Dr. Villari said. It's there is an increase on domestic violence and all the fears you can face in this situation. And people just like depressed. Even some of my colleagues are very scared about this situation, and it's complicated because it's very difficult even to stay with people that have suffered so much for this. Even if they didn't get ill, but I mean, it's something you understand that you cannot face such a fear. But not a psychiatric. Of course, I don't know exactly the situation, the number of people from a psychiatric point of view, of course.
Another question that is coming up in the chat box is the question about telehealth. If that's something that you've seen been used at all, and if there's been more use about, with telehealth since the pandemic began. And Dr. Battigiani, you are a surgeon, so I'm curious to hear if that is something that you have seen an increase in, even in your area.
Not in my specialty, but first of all, Tina, I would like to answer to Melanie Phelps, who asked early on how reliable were the tests, and that's very good point, because we experience in the wards some positivization of patients who normally access the ward only after test. So we know that swab are 80% positive, has sensitivity, and 20% are false negative. So this is a crucial question, because it's the origin of unwanted spread in the hospital. That is what we don't want at all, to spread the virus in the hospital. That's why we set at the entrance but all the wards did this approach using tents at the entrance of the hospital, just before to admit or sending home other also positive patients with symptom positive that could be treated at home. And this is the introduction to the last question about the telehealth. And I have no experience, because we have secretaries that face and are in contact with our patients, and they specify, ask about symptoms, and set all the routine tests that the patient should undergo before enter the hospital. But I think, of course, that in the basic medicine, with basic medicine, and doctors, family doctors are much more interested in this part, of course, and they use a lot of telehealth as well to visit with Zoom or other facilities their patients, and to suggest also drugs and other prescriptions.
And is that something they already were doing, or is that something that has been?
No, they are still doing with, in fact, because the policy is to keep the patient at home as much as you can. So we spoke a lot about the admission of the patients based on the saturation, oxygen saturation of the blood, and and if the saturation fail, this is a clear indication for admission, urgent admission, and then transfer of the patient in ICU.
May I say something about the test? So I agree with my colleague, and we have to say that the test alone is not enough. Could be dangerous because can put you in a false street. Test has a lot of false negative. So what is very important is a complete medical clearance and something that starts for epidemiology and medical history of the person and its group and contacts, and then the test has to be put in a complete medical assessment with, of course, if necessary, also RX, thorax, and something like this. The test alone is not enough. It's very dangerous. And there is a question about mandatory of a test. Is mandatory to come back, to be declared fully recovered. You have to undertake 2 tests, of course, negative. Otherwise, you cannot come back in work or in society. You have to remain home.
Tina, did you have another question?
Well, I saw you unmuted, so I wasn't sure if you were ready to have a question, but go ahead.
Yeah, I do. And it has to do with schools and universities. As we're looking toward the fall in the United States, some schools, at least where we are in the state of North Carolina, the public schools are trying to decide how they're going to come back, either online or in person or some hybrid method. Universities, some have said they're going to go back with in-person classes. Others have said just online. And I'm wondering about your schools and universities in Italy, the process that they're going through. Have they already decided what they're going to do? Roberta, would you tell us a little bit about that?
I didn't catch something, sorry.
Where are you all in Italy about opening schools for the fall? Schools and universities, are they going to see go in person or online?
Sorry, may I answer to the question first, because I'm an academic doctor, so we are using a lot of these not in presence lessons and examinations as well. We did by means of Meet and Zoom, etc. And this is due till September of this year for the university. And also primary schools are not working at the moment, and probably we hope that can reopen in fall, next fall. But we are not sure about this, and certainly we have a rector recently that specify that we have to distantiated the students and probably make a mixture between in presence and online examination as well, in order to avoid crowded rooms and other situations. But the problem is main also in for the School of Medicine, because we have to face the presence of the students in our hospital, and nobody wants to take to bear the responsibility to have some student contagiated, infected during their studies.
Thank you. Roberta, did you want to add?
Yes. For the academic part and the biggest young, Jacopo has answered. So regarding the other the children, the elementary school and the younger boys and girls, unfortunately, our government has not a real clear plan so far. And we are discussing about divide classes, classroom. So if you have 30 pupils, you divide them. One day 15 pupils come to school and the other day the other 15 people come to school. But is this something that really they don't know if it can work, because children should even respect the distance between each other, and as we say before, they don't. And I really hope that could be possible to find some solution, right, or maybe not perfect, but some solution we should find. Because, and I try to answer to Melanie first that asked about impact of the children after COVID in Italy. For what I could see with the children I see as patients and speaking with the parents. The most of the children without socializing in the houses, they became more irritable, and some of them have sleeping trouble, and the youngest child I've seen with some patients personally. They have a sort of delay of development because they feel the parental mood. The parents are scared about this situation. The most of the people, because if you can understand what happened, of course you are scared about that. And even if you can individually, we can support in some way the situation, or just logically understand that we have to go on in some way. But all of us are scared. I'm convinced about that. And because the little the children, youngest children, are I mean, they feel what the parents feel, and they are scared for that. I don't think they can understand the problem of COVID. But maybe about that, the Dr. Villari can say something more consistent than me.
But to be honest, I have to admit that maybe our government don't have at the moment clear idea what to do next for, how to start with the primary schools. And maybe also the university are thinking about. And we have to face the situation, and we have to wait and see what is going to happen with the infection, and then we can decide. Of course, children need to be together, but
yeah.
they need to be safe, first of all. So.
Okay, we're at the top of the hour, so I want to thank each and every one of you for getting on with us tonight over your dinner time. I recognize it's probably dinner time over there. And it's been wonderful to have you guys on, and I hope that maybe you'll join us again sometime. Tina?
Okay, maybe. Thank you so much for the opportunity and the invitation, and I hope we can fly to the States soon.
Yes, and we hope we can fly to Italy soon.
Okay.
Yes.
I'm waiting.
Well, thank
Bye-bye.
you.
For you, Tina.
Thank you. Thank you so much to our guests for today. We really do hope that they will join us back here in a few weeks' time again as we revisit and talk about how things are going in Italy and maybe even countries in Europe or across the world. Thank you to those of you who were part of today's session and who were here in the audience. We appreciate you as always for chiming in. And hope to see you in the next session. We will take a break for next week in observance of 4th of July, so we will take a break. And we will be back on July 10th, and we will talk racism in medicine in the United States. Thank you so much again, and thank you again to our
Bye.
guests.
Thank
And
you.
Bye.
Bye.
Bye. Thank you. Bye.
Bye.